Hello, my name is Annie Ferreri. In this presentation, I will discuss my proposal for a study that assesses the impact of an online behavior modification intervention program on adherence to the gluten-free diet in adults with celiac disease. Celiac disease is estimated to impact 1 in 100 people worldwide. Celiac disease is a common immune disorder that results in damage to the small intestine when an individual consumes gluten. There is currently no cure for celiac disease, leaving those diagnosed to implement a gluten-free diet as the only treatment method from often painful and uncomfortable abdominal and digestive symptoms, in the hopes of relief and recovery. Implementing a lifelong diet change can be challenging and can also create the need for behavior change in individuals from their eating habits to a new understanding of gluten-free diet requirements. This study aims to address if a behavior change intervention in the form of an online program improves adherence to a gluten-free diet through coaching and education in newly diagnosed adults. If successful, such a program could leave newly diagnosed patients with the foundation to make diet and lifestyle changes with confidence and to lessen initial overwhelm. The research question posed for this study is, in adults with celiac disease, does incorporating a behavior change intervention improve adherence to a gluten-free diet? According to current literature, gluten-free diet adherence has been reported at 45 to 90%, depending on the individual's background as well as other influential factors such as age of diagnosis, symptom severity, knowledge of certain gluten-free foods and understanding of food labels, and the cost and availability of gluten-free foods. There have been 5 intervention studies to date which have focused on adherence to the gluten-free diet, which have assessed dietary and psychological counseling interventions, online programs, and call-in clinics, to name a few. The current medical standard used to test for adherence is invasive and requires patients to undergo a duodenal biopsy and a blood test. In emerging literature, the use of surveys has been presented as a form of non-invasive measurement to test for adherence to a gluten-free diet. Such developed survey tools have only been tested in studies based in Europe and Australia, meaning no similar studies have been recreated and tested in the US. This study proposes testing the reliability and effectiveness of 2 developed survey tools used in prior studies to assess their impact on gluten-free diet adherence and program acceptability in adults with celiac disease in the US. Participants will be selected from those currently seeking treatment at the Celiac Center at Beth Israel Deaconess Medical Center in the northeastern US. This location was selected due to its focus and expertise in research and clinical trials relating to celiac disease. Since this study will require a relatively large sample size, a research hospital is an ideal setting as opposed to a selection of smaller clinics in the area. Participants will meet 4 criteria for the study. They must be adults over the age of 18, they must be newly diagnosed with celiac disease or under 1 year from diagnosis. Celiac disease must be the only identified disease, and their diagnosis must be confirmed through a previous biopsy before being considered for the study. 176 participants are required for the study. An a priori for sample size was conducted in G-Power using a t-test for 2 independent means, with a significance level of 0.05 and a power of 0.95, resulting in a sample size of 176. The sample size is similar to a prior study done in Australia, which used a sample size of 189 participants. This allows us to compare data to a prior study which developed and tested the online behavior modification intervention program. Participants will be randomly assigned to each of the intervention groups or the control groups. The study timeline is 6 weeks. Informed consent will be gathered from the participants before they partake in the study in any way to disclose risks associated with the study. The study will require approval from the IRB for its use of human subjects with a medical condition. The intervention is an already developed and tested online education and behavior modification program which consists of 6 modules. The study will take place over 6 weeks, giving the participants 1 week to complete each module. Participant responses to administered surveys throughout the program will be assessed for changes in adherence and acceptability and feasibility of each module in the program. The two types of survey tools will include a previously developed and validated survey to measure gluten-free diet adherence called the Celiac Disease Adherence Test, or the CDAT, which has been used to detect incomplete adherence effectively, as well as a modified questionnaire for each module of the program, which has been tested in prior studies done in Australia. All participants will take the initial CDAT survey to gather baseline adherence data. Then the intervention group will partake in the online behavior modification program over the course of 6 weeks. Upon completion, the intervention and control groups will retake the CDAT to compare any changes in adherence with and without the intervention program. The study will collect quantitative data in the form of participant responses to the 8 surveys, the CDAT before and after the program to assess any changes in adherence, as well as the program questionnaire issued at the end of each of the 6 modules for those participants in the intervention group. The data will be analyzed through descriptive statistics, and the chi-square test for differences will be used to compare module questionnaire responses. This table shows how response data will be compared for each module using the mean and the percent of the sample size pertaining to the specified response rating. This will allow us to compare module data to prior studies using the online intervention program. Further, we will be able to analyze the acceptability and feasibility of the program modules as they pertain to changes in gluten-free diet adherence. The study aims to improve adherence to the gluten-free diet in adults with celiac disease through the incorporation of an effective and acceptable behavior change intervention, which has been a historically limited research topic. With the high prevalence of celiac disease and no medical cure, patients with the disease may benefit from a tested program, and the only way to certify the effectiveness of such a program is through additional research. The limitations of the study are identified as the attrition rates of participants completing the program, which has been found to be high in similar studies, as well as the validity and reliability of self-reported surveys. The hypothesis we are testing is defined as the following. In adults with celiac disease, incorporating a behavior change intervention does not improve adherence to a gluten-free diet. Our research question will be answered when we have compared response data from the intervention group back to the control group to assess the effect, if any, on a behavior modification intervention program on gluten-free diet adherence over the course of 6 weeks in newly diagnosed patients implementing a gluten-free diet. This concludes the presentation. Thank you for your time.